The two most common urinary incontinence problems are stress and urge incontinence. Dr. Elmer Pineda of Pomona Valley Hospital Medical Center explains these conditions and treatments for both.
There are many different types of urinary incontinence, actually. The most common types that we see in our office are stress incontinence, urge incontinence, or commonly a mixture of both. Stress is the involuntary loss of urine, say, when you apply any pressure to the bladder, when you cough, sneeze, or laugh. So that type of stress, physical stress on the bladder, makes you leak urine, and that's more commonly a result of weakness around the urethra and the bladder neck. Urge incontinence is defined as you leak urine when you have this urge to urinate that's just difficult to defer. Most patients, well actually all patients, when they have an urge to go urinate, they can make it to the restroom in time. For those with urge incontinence, they really can't hold it. And there are some causes of that, such as urinary tract infections or drinking a lot of fluid or caffeine and alcohol. But for the most part, we don't know what causes urgency incontinence, you just have it. For those with both stress and urge incontinence, we start off with simple things, and those are Kegel exercises, with or without physical therapy, and physical therapists can actually help you with this. Fluid moderation, not drinking beyond your thirst, and being careful of caffeine and alcohol. Those three things are really the mainstay for those two cases.
Dr. Pineda says symptoms are the key to how he treats patients.
For those with stress incontinence, if Kegel exercises don't work, we talk about surgical options such as urethral slings. And for those with urgency incontinence, we talk about medicines such as there's a medicine that can relax the bladder to give you enough time to make it to the restroom, and those are called anticholinergic medicines.
Dr. Pineda tells us how not treating this condition can have adverse effects.
A lot of patients that I see are too embarrassed to come to the doctor in the first place, and it gets to the point where they're having so much leakage that it affects the quality of their life, that they're forced to see a doctor when they could have seen them much earlier. And it's interesting, there's even some patients who think this is normal. It's just a part of aging, when it's really not. I've seen some patients restrict their activity, they don't exercise, or they don't pick up their children. I've seen some patients who spend a lot of money on urinary pad use. I've seen some patients where it actually becomes a danger to their health. They develop rashes because of the wetness that they're sitting in most of the time. And there are some elderly patients, and this is the saddest part, where they slip and fall in the bathroom because there's wetness in the bathroom and they break their hip. We're pretty successful at treating this condition. And that is a combination of exercises, may involve medical therapy, and there's even surgical options that we can do for you.